As part of the sensory evaluation, joint sense is evaluated. With the patient seated and blindfolded, the affected upper limb is supported by the therapist and moved to different positions, asking the patient to perform identical motion or position with the unaffected extremity. Stage 3 is when voluntary effort appears. We use this rowing exercise to demonstrate the voluntary effort as it begins. The patient is asked to hold the isometric contraction. If successful, he is asked for an eccentric contraction, then a concentric contraction again, and finally reversal of the movement between the agonist and antagonist. Corrector movement is repeated. Treatment principles. When no motion exists, movement is facilitated using reflexes, associated reactions, and proprioceptive facilitation to develop muscle tension in preparation for voluntary movement. The responses of the patient from such facilitation combine with the patient's voluntary effort to produce semi-voluntary movement. Facilitation is reduced or dropped out as quickly as the patient shows voluntary control. Correct movement is repeated, and then we practice in the form of an ADL.